Hello, and welcome to the new MDT Member Orientation webinar. My name is Meg Hatch, and I am the coordinator for the Maine network of Children's Advocacy Centers. Here at the network, we provide support for existing and emerging Children's Advocacy Centers across the state. And we do that through resource sharing and mentoring, training and technical assistance. We also do public policy advocacy, and we do statewide communication. Our work here is in promoting the development and growth and utilization of children's advocacy centers and multidisciplinary teams to more effectively respond to Maine's sexually abused children and their families. As you all probably know, each discipline's work includes a unique set of acronyms and abbreviations. I've already started out with one today. MDT stands for Multidisciplinary Team. I will do my best to spell them out so that you know what they mean, but in the event that I forget, please feel free to just shoot me an email after the presentation and I will clarify what I was talking about. I also encourage you to grab a pen and paper so that as things come up during this presentation, you can just jot them down and then you can email me or your MDT or CAC coordinator after the presentation and ask those follow-up questions. Also, at the end of this presentation, you will see a link to a very brief evaluation, and we would really appreciate it if you could just take a couple of minutes and fill it out so that we can know how we're doing with this webinar and whether or not it was helpful for you. So your feedback is really important to us, and we would appreciate if you would just take a few minutes to do that. So we're going to start right out here talking about working as a team. And so I'm sure many of you have experienced working as a team and have probably experienced some of the challenges that come with working as a team. And so certainly the Children's Advocacy Center model, the foundation is really built on the multidisciplinary team and working together. So some challenges that come up pretty regularly in the Children's Advocacy Center multidisciplinary team approach are that each discipline has different mandates or philosophies or responsibilities, and that they don't always align perfectly with each other's disciplines. Team members may not have a full understanding of what exactly other members' roles are, and so sometimes that can cause confusion about why someone is or isn't doing something. Sometimes folks feel like when they work as a team, they're sort of giving up their sense of control over what happens in an investigation. And just in general, working with other personalities can sometimes just be challenging, particularly if you're used to doing stuff independently. Working as a team can feel really just difficult. But I'm sure some of you who have experienced working as a team also know that working as a team can really be very beneficial and really productive. And so certainly when we're talking about dealing with child sexual abuse and these cases, it's difficult subject matter. So sometimes working as a team can really help folks to feel like they're working with other people who understand the work that you do. And that can be really beneficial in just feeling supported and validated in some of the challenges that come with the work. It can be a great way to share time and resources. Working as a team, oftentimes you can come up with some really great creative problem-solving techniques, and really having a sense of a shared responsibility of keeping kids and families safe in your own communities. So, as I said before, sort of working as a team really is a core value of being a Children's Advocacy Center and having a multidisciplinary team. So, after the presentation today, I'm hoping that you'll come away with a few things, and they're outlined here on this slide. So I'm hoping that you will feel like you have an increased understanding of the Children's Advocacy Center model, that you have an increased understanding of the services that are provided at the CAC, that you'll know how to make a referral to the CAC, and then a little bit of information about other responsibilities as a multidisciplinary team member. So I first want to talk a little bit about Children's Advocacy Centers and the history of advocacy centers across the country. So there's a national network of Children's Advocacy Centers both across the country and now even internationally. So other countries are adopting this model as a way to investigate these cases. The first Children's Advocacy Center was established in Huntsville, Alabama in 1985. And this came about as a result of a particularly difficult sexual abuse case that then prosecutor Bud Kramer had worked on. And when the trial was over, what he heard from the victim and their family was that the criminal justice process was nearly as traumatic as the abuse that the child had suffered itself. And so this really sort of made Mr. Kramer rethink how investigations happen. And as a result, he convened a multidisciplinary team, and they began working collaboratively on figuring out how to make these cases, these very difficult cases, maybe just a little bit easier, particularly for the child and family who were experiencing the systems. So currently there are over 800 children's advocacy centers in the United States. They're all based on a similar framework of 10 standards that are outlined by the National Children's Alliance. However, there's quite a bit of variance in programming from Children's Advocacy Center to Children's Advocacy Center because they really are a grassroots program that comes from the community in which you live. So they're sort of based on the 10 standards, but there's quite a bit of flexibility within those standards so that the program really meets the needs of your community. So here in Maine, we have 3 children's advocacy centers that are currently seeing kids, and then we have another multidisciplinary team that is meeting and in the development process. So the Androscoggin Children's Advocacy Center serves Androscoggin County and also Franklin County. There's an office in Lewiston and there's an office in Farmington. The Androscoggin Children's Advocacy Center will also soon be seeing kids in the Oxford County area at an office in South Paris. The Children's Advocacy Center of Kennebec and Somerset counties serves those 2 counties and is located in Waterville. The Cumberland County Children's Advocacy Center serves Cumberland County and is located in Portland. And the Penquist Children's Advocacy Center is the center that's in development, so they're not yet seeing kids there, but that will most likely be located in the Bangor area and will serve Penobscot and Piscataquis counties. So in addition to the Children's Advocacy Centers in Maine, there's also the Maine Network of Children's Advocacy Centers, which is located in Augusta, and we serve the state. And so we provide, as I talked about earlier, training and technical assistance and support for existing and emerging centers across Maine. There's also the National Children's Alliance, which I just briefly mentioned, and they are the folks who provide accreditation and the standards for development. It's located in Washington, D.C. They also provide lots of online technical assistance. They house national and state statistics. They also administer the outcome measurement surveys, which collect data on Children's Advocacy Center client satisfaction and the efficacy of the program. They also provide advocacy and lobbying to the federal government, and they host an annual leadership conference in Washington, D.C. every June. The National Children's Advocacy Center is located in Huntsville, Alabama, and so just a little bit ago I talked about Bud Kramer and his development of a Children's Advocacy Center, and so that's where it is. The National Children's Advocacy Center provides training on many topics that are relevant to the work at CACs. So these trainings include both basic and advanced forensic interviewer training, family advocate training, special trainings for prosecutors and medical providers, and other topic areas that are relevant to Children's Advocacy Center work. The National CAC also hosts an annual international symposium on child abuse, and they have a really impressive online research library that's really easily accessible, and also they have on staff a couple of research librarians who will help you find whatever you're looking for as it relates to children's advocacy centers and child abuse. So just a really fantastic resource. And they're also the functioning Children's Advocacy Center for that county. And then finally, we have the Northeast Regional Children's Advocacy Center, which is located in Philadelphia. And the Northeast Regional Children's Advocacy Center provides us with training and technical assistance here in Maine. They also provide service to all of the rest of New England, New York, New Jersey, and Pennsylvania. And so they provide multidisciplinary team training and support for MDT members to attend both regional and national trainings. So they're just another resource out there that's here to support the growth and development of children's advocacy centers. All right, so we're going to look at a couple of slides here just to present you with a few statistics. And so I have numbers here from 2014. So as you can see, the Androscoggin Children's Advocacy Center in 2014 provided 215 forensic interviews, and the Children's Advocacy Center of Kennebec and Somerset County provided 204 interviews. So that's quite a significant amount of interviews in a year, but that's a statistic for 2014. The reason that the Cumberland County Children's Advocacy Center is not in here because they just started seeing kids this June, so June of 2015. So next year, they'll be part of these statistics. And then here's just sort of a breakdown of children by gender and age. So this is the gender of the victim and the age of the victim. All right, so we've talked a little bit about where the CACs are here in Maine, and then some of the state and national resources that are available to existing and emerging children's advocacy centers. And now I kind of want to delve into a little bit more about what is the CAC model, and what does it mean to be a multidisciplinary team partner working within the Children's Advocacy Center model. So they're facility-based programs, which means that the CAC is an actual place. And so it may be located within a building that serves other purposes, or it may be a standalone structure. And so it's going to look different depending on what your community is. So for example, the Androscoggin Children's Advocacy Center has space at the Sexual Assault Prevention and Response Services office that's located in Lewiston, and also another space at their office that's located in Farmington. The Children's Advocacy Center of Kennebec and Somerset counties is located at the Thayer campus of Maine General Medical Center in Waterville. And the Cumberland County Children's Advocacy Center is located at the Spurwink Child Abuse Clinic in Portland. So they're all sort of based in different places. Sometimes they're their own space. So again, it's going to look sort of different depending on your community. So who are your MDT partners? We've been talking a lot about multidisciplinary teams and MDT partners. And so there are sort of core essential disciplines that the National Children's Alliance outlines in their standards. And so those include law enforcement, child protective services, the district attorney's office, medical providers, mental health providers, victim advocacy providers, and children's advocacy center staff. However, as we talked about before, children's advocacy centers are unique to their own communities. So some MDTs may also include other partners, and some of those other partners that people have as part of their team around the country may include clergy, children's case managers, school personnel, or basically any other professionals who work with children. And so what types of abuse might you send to a children's advocacy center? So the 3 CACs that are here in Maine serve primarily victims of child sexual abuse. However, both will interview kids when there are other concerns that either law enforcement or child protective services has, but they are outlined really as there needs to be a primary concern of sexual abuse. Across the country, that looks different. So some CACs serve only kids who are sexually abused, and then some CACs may see a broader range of kids from anything from physical, sexual, emotional abuse, neglect, witness to domestic violence, or witness to homicide. So again, that's another thing that sort of might look different depending on where you are. So now I want to talk a little bit about how kids and families get to the children's advocacy centers. And so they're referred to the CACs by either law enforcement or child protective services. Law enforcement or child protective services will call the CAC to make a referral. And what happens is the CAC sort of fills out an initial intake, and then they will contact the other partners and the non-offending caregiver to coordinate a time that works for everyone. So when the Children's Advocacy Center makes contact with the non-offending caregiver. It's really an opportunity for that non-offending caregiver to be informed about what to expect when they come to the CAC, and it's also an opportunity for them to ask questions. So that's another sort of like core piece of the services provided at the Children's Advocacy Center, and that's really making sure that the non-offending caregiver feels well informed about the process from the beginning, so that they can more appropriately support their child. Once an appointment has been made and confirmed, the MDT members are then asked to arrive a little bit before the child and family. And so that allows some time for the MDT partners to meet with the forensic interviewer and for some information sharing to occur. It also allows for that the multidisciplinary team to sort of be there and off in their little space before the child and family arrive, so it's not like the child and family are arriving to a place where there's a police officer and a child protective worker and maybe some other people there. So it's really about creating a safe space for when the family gets there. Once they get there, they're greeted by CAC staff and made comfortable in a waiting area. Once they've had a chance to settle in, the non-offending caregiver will go in and have a meeting with the multidisciplinary team before the child goes in for their forensic interview. So again, this is another opportunity for the non-offending caregiver to ask questions and also for them to be able to provide information regarding the concerns or allegations. The multidisciplinary team will also ask the non-offending caregiver to share any additional information that they think might be helpful for them to know about the child, particularly before the forensic interviewer goes in with that child. So it's just really an opportunity for information sharing and question answering. So once that meeting is complete, the non-offending caregiver will go back to the waiting area and the forensic interviewer will get their recording equipment set up. So all 3 Children's Advocacy Centers here in Maine make DVD recordings of the interviews. So that will be if you're a law enforcement or child protective investigator. When you walk away from the Children's Advocacy Center after having witnessed a forensic interview, you will leave with a copy of that DVD. So the forensic interviewer will then go get the child and they'll take them into the interview room. The interview can be seen by other MDT members, so either through a closed circuit TV or a one-way mirror. So in one room you have the child and the interviewer, and then in the other room you have the multidisciplinary team members who are watching the interview. The interviewer's job is to conduct a legally sound, child-centered, developmentally appropriate interview while the other MDT members observe. There's also an opportunity for those MDT members to ask additional or follow-up questions. And so that, again, that's going to look a little bit different depending on where you are. But at a certain point, the interviewer will indicate to the team that they have sort of asked all the questions that they can think of to ask. And then the multidisciplinary team members will communicate in some way the additional questions to the interviewer. So sometimes the interviewer will take a break and they'll step out and into the multidisciplinary team observation room and just have a quick conversation. Sometimes multidisciplinary team members will jot down additional questions and then we'll knock on the interview room door and hand the forensic interviewer a piece of paper with additional questions. So again, that's going to look a little bit different depending on your CAC. While the child is being interviewed, the non-offending caregiver meets with a family advocate or family services coordinator to really talk about the needs of the child and the family from that caregiver's perspective. It's also an opportunity for the family advocate to make referrals for a medical forensic follow-up exam, for mental health or counseling service if the non-offending caregiver thinks that would be helpful for the child. And also other advocacy services through their local sexual assault crisis and support center or other community supports that the family may need. So again, it's really just another opportunity for that non-offending caregiver to feel like they're well informed about the process and also getting all the needs met. Once the forensic interview is complete, the child is reunited with their caregiver and the MDT meets briefly to discuss next steps. And also what information might be shared with the non-offending caregiver. The non-offending caregiver then meets with the MDT a second time after the interview, and so that again is another opportunity for the MDT members to share information with the non-offending caregiver that allows them to feel well informed and to be able to keep their child safe. However, that information is sometimes limited just because they don't want to do anything to compromise the integrity of the investigation. It's also another opportunity for that person to ask questions and talk about sort of what the next steps are going to be. So law enforcement or child protective services can then say to the non-offending caregiver, here are the things that are going to happen next. So again, they feel well informed, and that helps them be able to better support their child. Once that meeting is complete, the non-offending caregiver may be asked to complete a brief survey, and then they're done at the CAC. And so the CAC will then provide a follow-up phone call after 1 week and again after 1 month. And that's in order to ensure that the child and family have been successful in setting up their referral appointments, and also to see if there are any other unmet needs with which the CAC can be helpful. Sometimes MDT members may stay a little bit after the family leaves, and that's really just an opportunity for them to discuss next steps and talk about what's going to happen from there. So I'm just going to give you a couple of seconds here to jot down any questions that you might have up at this point. And again, at the end, you're going to get contact information both for myself and for the CACs or MDT members in your area. All right, so we talked a little bit about a few of these things, but I'm just going to sort of go into a little more detail here. So as far as referrals, we already mentioned that they come to the CAC through either law enforcement or child protective services. So those are the two sort of disciplines that are making referrals to the CAC. The district attorney's office can also make a referral to the CAC, but that usually is in conjunction with law enforcement. The CACs do not take referrals from parents or school personnel, from medical facilities, or mental health providers. So if a call like this comes into the CAC from someone who's not law enforcement or child protective, they're advised to make their mandated reports to the child abuse hotline and or the DA's office. So when you make a referral to the CAC, the staff will sort of answer the phone. They'll walk you through the intake information that they need. You're going to be asked to provide the name and contact information for the child and non-offending caregiver, to provide your name and contact information. You may be asked for a brief description of the allegations, if there are any interpreter services or transportation services needed. You may be asked about who else is involved in the case as far as other disciplines. And you may or may not know, and that's fine. The CAC will help you figure out who those people are. So you may be asked to give some dates and times that work for you. You may also be asked to inform the family that they'll be hearing from the Children's Advocacy Center to set up an interview. So it's usually not the Children's Advocacy Center calling a family to let them know that a report's been made to the department or to law enforcement. So the CAC is asking those disciplines to make initial contact with the family and let them know that they're going to be hearing from the Children's Advocacy Center to set up a time for a forensic interview to happen. So again, this may look a little bit different from CAC to CAC, and so that's okay. We just want you to be aware of that. And so just also to know that it's law enforcement and child protective services that are making those decisions about which cases go to the CAC. It's not the Children's Advocacy Center staff. So in certain circumstances, you may be getting a call from the Children's Advocacy Center regarding a case that you don't know about yet. So if Child Protective calls in a referral, the CAC might call law enforcement to let them know that an interview is going to happen, but law enforcement may not have that referral yet from the DA's office. So sometimes the CAC may know about a case before you do, and so it's just really about the CAC sort of coordinating that interview as early as they possibly can. And so in those cases where maybe you have not been assigned yet, it's really the Children's Advocacy Center is just letting you know that an interview is happening, and so then you can make a decision about whether or not you're going to be there for it. Interviews will only happen at the CAC if an MDT member is present. So you can't just send a case there. If you're making a referral to the CAC, there is an expectation that you will be present for the interview. And so that's, really with the hope that MDT members who need to be present are there from the beginning and have opportunities to ask all the questions that they need to, so that we're minimizing the number of times that child is being interviewed. So in addition to sort of the process that happens at the Children's Advocacy Center, multidisciplinary team members may be, as a multidisciplinary team member, you may be asked to be part of other groups. So all of the CACs have sort of an advisory committee, or an advisory board, and that group is made up of MDT members from each disciplines. They're going to be meeting on a regular basis to discuss successes and challenges of the CAC and to ensure that MDT members are following the protocols of the Children's Advocacy Centers. They're also sort of charged with the development and updating of protocols as needed. And so again, these groups are going to look a little bit different depending on which CAC you're working with. You may be, if you're an investigator or a forensic interviewer at a Children's Advocacy Center or a medical provider or mental health provider, you may be asked to participate in case review. And so again, that's going to look a little bit different depending on which CAC you're working with, but they usually occur on a monthly basis. It's an opportunity for MDT members to look at cases that have been to the CAC but are still active and ongoing. You may be informed by your MDT coordinator that a case you're investigating or involved in will be reviewed. If you have questions about what that means, I would encourage you to ask them of the person who's asking you to come to case review, or get in touch with your supervisor or somebody else that you work with who has been to a case review, and they can maybe share a little bit more information about what that means. And so really the purpose of case review is to ensure that the child and the family have been successful in follow-up with their referrals. It's used to sort of identify gaps in the systems and really to sort of do that team problem solving using the expertise of your MDT members. If you're trained as a forensic interviewer at the Children's Advocacy Center, you will be asked to attend a regular peer review meeting. And that's where one of the interviewers from the CAC will bring in a DVD, and they will review it with their peers, talk about what worked well, talk about what some of the challenges were. And again, the sort of purpose of the peer review is really to improve interviewer skills, and again, use that expertise to problem solve. Another thing that's sort of great about being part of the MDT is access to sort of training opportunities. And those are state trainings or national trainings. And so both here at the network and at your local CACs, we're kept pretty well informed about training opportunities that are coming up. And so those will be shared at your advisory committee meetings or case review meetings. So again, remember that there's lots of resources out there and lots of friendly CAC colleagues who are looking to help you out if and when you need it. So I would encourage you to get in touch with your local CAC coordinator if you haven't done that already. I would also encourage you to reach out to other folks from your own discipline who have had experience in working with a Children's Advocacy Center. And so that way those folks maybe can best answer your questions as it relates specifically to your discipline. You can always contact me here at the network, and you're going to see some slides here at the end that have information about that. And certainly the National Children's Alliance, the National Children's Advocacy Center, and the Northeast Regional Children's Advocacy Center are all great resources that you can reach out to as well. So here is a slide with my contact information on it. And then here is a slide with contact information for each Children's Advocacy Center across the state. And so I would encourage you again to reach out, and you're going to see there's a little bubble that's popped up here on the screen here that has a link to a brief Survey Monkey. And so again, if you could please just take a couple of minutes to fill that out, we would really appreciate your feedback. So again, thanks so much for taking the time to watch this, and we hope you found it to be helpful. Hope you have a great rest of the day.